The growing interest in psychedelics within palliative care represents a profound shift in how we think about aging, dying, and the quality of our final years. While the dominant narrative in medicine has long been focused on longevity, how to extend life, delay death, and prolong biological function, there is now a parallel conversation emerging. What if the ultimate goal is not just to live longer, but to live better, especially when facing the end of life? In this context, substances like psilocybin are being revisited not as recreational drugs or fringe therapies, but as powerful tools for alleviating emotional suffering, restoring meaning, and improving the psychological and spiritual quality of a person's final chapter. Psilocybin, a naturally occurring compound found in certain mushrooms, interacts primarily with serotonin receptors, especially 5-HT2A, leading to altered states of consciousness often described as expansive, insightful, or emotionally cathartic. In controlled clinical settings, it has shown remarkable promise for people with terminal cancer or advanced illnesses who face overwhelming anxiety, depression, or existential distress. What these studies reveal is not just temporary mood enhancement, but a deeper, more lasting shift in how patients relate to their condition, their mortality, and their remaining time. In trials conducted at institutions such as Johns Hopkins and NYU, a single dose of psilocybin, administered in a guided therapeutic setting, has led to rapid and sustained improvements in mood, reductions in death anxiety, and an increased sense of peace and connection. Many patients report profound spiritual or philosophical insights, including a sense of unity, forgiveness, or clarity about life and death. These are not abstract or esoteric effects. They translate into measurable outcomes like improved sleep, reduced need for pain medications, and greater engagement in relationships or legacy-building activities. This raises a profound question. Should end-of-life care prioritize not just physical comfort, but psychological and existential relief? Traditional palliative treatments often focus on managing pain, fatigue, and nausea through pharmaceuticals, but emotional and spiritual suffering is harder to reach. Antidepressants can take weeks to work, if they work at all, and they rarely offer the kind of meaningful, holistic transformation that psychedelics appear capable of inducing in a matter of hours. Importantly, these benefits don't come at the cost of awareness or agency. Unlike sedatives or narcotics that dull consciousness, psilocybin appears to heighten awareness, enabling patients to process and integrate their experiences with clarity and often with gratitude. For many, the experience doesn't eliminate the fear of death, but transforms it, replacing dread with acceptance, isolation with connection, and despair with a renewed sense of wonder or purpose. This reorientation toward quality of life is critical because modern medicine often extends life without necessarily improving it. Patients may endure months or even years of treatments that preserve vital signs while diminishing daily joy. In such cases, psychedelic-assisted therapy offers a different promise, not of more time, but of deeper presence. It's about expanding the value of the remaining time, not just the quantity. Critics might argue that this is not truly anti-aging in the conventional sense. And they're right. It's something more fundamental. It challenges the very premise that the best we can do in aging and dying is to delay the inevitable. Instead, it suggests that emotional healing, reconnection, and transcendence are just as vital as cellular repair or lifespan extension. Psychedelics don't make people immortal, but they may make them more fully alive in their final days, which is arguably a more profound form of medicine. There's also growing interest in whether these benefits could extend to earlier stages of aging. Could older adults, well before entering hospice or terminal care, benefit from psychedelic therapy as a way to confront life transitions, loss of identity, or fear of decline? Early evidence suggests the answer may be yes, opening new avenues for helping people age, not just with dignity, but with meaning. Of course, these therapies must be approached with caution and care. Psychedelics are not a panacea, and their use, particularly in vulnerable populations, requires skilled guidance, medical supervision, and ethical safeguards. But when administered responsibly, they appear to offer a powerful tool for helping people confront mortality not with fear, but with clarity, insight, and even peace. In this light, the debate between quality of life and longevity begins to shift. It's not necessarily one or the other. What psychedelics offer is a bridge between the two, the possibility that even in the face of death, we can find healing, connection, and a deeper experience of being alive. As science continues to explore these frontiers, it's possible that the most profound gift we can give to those at the end of life isn't more time, but the ability to fully inhabit the time they have left.